I'm Carol Anders. I'm the director of Spirit Mountain Hospice here in Cody. I've worked with the hospice team now for 15 years total. I've been the director for 7 years. Hospice is my passion. It's a service that we provide for the community. We do in-home hospice care for patients that prefer to stay home. We cover basically a 50-mile radius of Cody. We go to Burlington, Meteetsee, North Fork, South Fork, Powell, and everywhere in between. So we service a large area, and then we also have a beautiful inpatient hospice facility, the only one in the Bighorn Basin. My team consists of nurses, CNAs, social workers, chaplains. We provide bereavement and grief support for 13 months after someone has passed. The qualifications for hospice are 6 months or less prognosis. We actually have some people that graduate from hospice. They get better, we manage the symptoms well, and they're able to discharge from hospice, and then they can be readmitted at any given time. So that's nice, and it gives people freedom. If they want to do last wishes, a travel or a trip or a concert, they can go do that and then come right back on service. One thing special about our facility that's different from a hospital, and people don't often realize that, is that they can go home for the day if they're able to and have their family members take them for a drive up the North Fork or the South Fork or something. We have a beautiful dining room. We have celebrations here, anniversaries, birthdays. Families can use the kitchen and prepare meals and cakes and those kinds of things. Another great service we offer is we have a team of volunteers that sits and reads with patients. They'll go into the home and give a few hours of respite for somebody, and we can arrange that. The volunteers here at the hospice house sit with patients. They help us with the meal prep. We prepare all the breakfasts from scratch, and then lunch and dinner comes from the hospital. I will say we have a full service pantry, so if anybody wakes up at 2 in the morning and they want a snack or something, we accommodate to whatever anybody wants, and we always have cookies. So really proud of this facility. When I first started working in hospice, we did not have an inpatient facility, so when caregivers were worn out, there was no place for them to go but one bedroom or one room at our long-term care facility. So this was the previous director's dream. Through grants and fundraising, we were able to accomplish this beautiful facility. It has 8 beds. All the rooms are private. Families can stay. There's little couches, sofas that make into beds that people can stay. We can get guest trays and people can eat with their family. And we not only care for the patient, but we're there to support the family and help everybody through the grief process. And that's basically what hospice is about. And I guess that pretty much explains the difference between a hospice home and hospice facility. One of the other benefits is we take 100% of whatever patients, of whatever Medicare pays. But I will say we have fundraisers, charity care funds. Medicare does not pay for the room and board, and that scares a lot of people. But that's why we have this big fundraisers and the donations that people give. They're very generous in the community. So that if someone can't afford the room and board, then we can tap into that fund and help them apply for Medicaid or something which pays a portion of the room and board. So finances should never be an issue. We accept everyone irregardless of ability to pay. So that's really important for everyone out there to know that finances shouldn't inhibit anyone from the great care. Basically here at the Hospice House, it's tender loving care, it's a home-like environment, and one-on-one care, just a lot of TLC for the families and for the patient. Included is the nursing care, all the food of course, the CNA care, the chaplains, the social work, and the chaplain is, he's not there for spiritual, he'll pray with you and stuff, but he's non-denominational, so he's basically there to support with the grief process and help people with the life review. The social workers are there to help with the finance end of things, but also there's 3 of them, and they provide the grief support and the follow-up after a patient passes. So that's kind of what those members of our team do. And all of that is covered by Medicare, most insurances, and like I said, we assist with the room and board whenever possible. So it's a wonderful program that we have here at Cody Regional Health. And like I said, the criteria for hospice is a 6-month or less prognosis from your physician and an order. And then patients come in here, we provide all the medications related to the terminal diagnosis, and keep you comfortable. We have beautiful patios and flowers and wildlife, fountains. We just recently had some bird feeders put up, or bird houses, excuse me, put up outside, so outside of each room everyone could see these little bird houses. So hopefully the birds will find them and they'll be occupied, so we're pretty excited about that. The beautiful flowers that Northern Gardens provides us, it's one of the great amenities here is just the beautiful patios and the scenery and the wildlife, the deer walking by, and all of that. The beds have the capability to go outside on the patio door, and the feet go down and the head raises up, and it's like a chair. So if someone's bedbound, there's no reason, if they want to go outside on a beautiful day, that they can't just go outside and sit. But as I said, if someone wants to go on a ride or something, they can. We did have some people that needed some assistance to get out here, but they had some last wishes. So our EMS crew actually took a patient on a 4-wheeler ride and for drives and stuff, and then they assist them out. And some of those experiences are just fantastic. If last wishes is a huge thing for us. So if someone has a desire to go out somewhere and do something, then definitely we'll do everything that we can, and within the patient's wishes to accommodate that. So that's one special thing that we do. And I talked about our service area. It's basically the Bayport Basin all the way to Burlington, and Powell, Meeteetse, North Fork, South Fork, all of Cody, and anywhere between here and Powell, and out to the Powell city limits, down the Willwood. So a lot of people, I just heard the other day that someone thought we just serviced Cody only, and that's not true. We have quite a large service area and nurses that travel to people's homes. Caregiving at home is one of the hardest things anybody ever has to do. So we provide respite services. Patients can come in, it's part of the Medicare benefit, and they can come in here for 5 days and get family members a break so that they can get caught up and get rested, take care of some business, and then go back home. their family and their loved ones. Another thing, a lot of people don't like to leave their pets. Dogs, cats, if they have their vaccinations, they can come and see the patient. Someone can bring them in, and then they can see their pet here at this facility. So that's, I think, really important and special. We have quite a few people that are very attached to their pets, and that's their best friends. And so just to be able to let those come in is a nice thing that we offer as well. So any questions about our hospice services, just let me know. We also do home health services, and it's the same service area, same team of nurses. A lot of people will start on home health and transition to hospice, or they just have an acute need and need some home health nursing team to come into their home and care for them if they're homebound and unable to get out. So that's another service that we offer, which is fantastic. And just knowing that if there is a terminal diagnosis, then we can always transition to hospice whenever anyone's ready. And we're open to discuss hospice with patients and families, tell them what it's all about, make them feel comfortable, and then they can just think about it for a little bit, because it is a hard decision. But I will say that I'm very proud of my team and the comfort level that they give to the patients. And we do surveys of all of our patients, and our last star rating on Medicare was 4 stars, and the survey results 100% satisfaction. So like I said, I'm really proud of my team. It's quite a large team. I don't think a lot of people are aware of all the disciplines that are involved in hospice care. So,
can you tell us what the average price is per night, or per day for us to stay? So you said, everything is covered except for that room and board, which I think is important. I'm sure people are wondering.
Yeah, the room and board charge is $306 a day. But like I said, with the charity care and the Medicaid applications, most people qualify. But there's also a deposit that we ask for if someone doesn't qualify for our charity care funds and happens to have the financial resources to come in here. So we evaluate that on a patient-by-patient basis. A lot of people are surprised at the cost, but if you compare it to long-term care or any of those others, it's really not bad at all. It's very comparable to any other inpatient facility, and obviously much cheaper than the hospitals. So.
Do a tour?
Right now, I'm just going to take you on a tour of the hospice house, and I'll describe all of the beautiful things we have here. This here is our grand room. There's a fireplace, as you can see. There's a reception desk up there. Unfortunately, it's snowing outside today instead of a beautiful spring day. But this grand room, families utilize it as well as patients and sit out here. One of our volunteers is usually at the desk up there to greet people and to guide them in the right direction. And then over here, there's a piano. We do music therapy as another service that we offer. We have a music therapist that'll come in and sing and play music with people. That's her specialty, and a lot of our patients find that really relaxing. And then this is the kitchen area. There's a large dining table. Like I said, all the meals are prepped in here, and we used to initially, when we opened in 2011, would microwave the food, but the quality wasn't good. So now we have it delivered in vats and prep it right here, so the food is much better quality. And I will point out our cookie jar. We always have a cookie jar full of cookies, and those are usually made by the volunteers. And then out here is our patio. And this is the main patio. All the patients' patios aren't this big. But one of the fountains is out there, and there's bricks, if you can see them, with patient names on them. And there's a brick campaign. It's part of our fundraising efforts to help people afford the room and board. And people buy bricks in memory of their loved ones, or for someone that they're really respecting and admiring. We've had them for all reasons, but that's been a really good campaign.
And each patient has their own patio?
Yes, and each patient has their own patio, and I'll show you one of those here in just a little bit. And now we'll head into the conference room. There's a public bathroom right here on our way into there. Little section here for kids, toys, stuff like that they can play with. A lot of times there's children here, so it keeps them occupied. We do, with the pandemic and everything going on, require masks, but visitors can come 24 hours a day, 7 days a week. We don't restrict visitation at all, and our doors are open, so that's our only restriction right now. So next we'll head into the chapel. This beautiful room in the stained glass, I will say all the artwork here was made by local artists, and when the sun's shining on that just right, it's just beautiful. But this is a private, quiet place that families can sit with our chaplain and pray. It's just a beautiful, quiet room. Sit here and read and have some privacy and just take a little time. And then behind us here, this is another place that families can come, sit, have privacy. There's a computer over here and a printer that people can use to, if they need airline tickets or something like that. But it's a guest computer, so people can get on it and use it. We also have a lot of staff meetings in here. There's a big screen TV up here, another fireplace down here. A lot of books to read and stuff. So there's some private places that people can step out of the room and take a break. Over here there's always a puzzle going. So we have a whole closet full, hundreds and hundreds of puzzles, and patients and families just love doing the puzzles. It's kind of a fun time out thing as well. There's one office in here, shared by many of us, but we have an open door policy. If anybody wants to come in and talk, or if they have questions, just pop in. So, and let's go check out a patient room. All the patient rooms are essentially the same. This one, there's 4 rooms that have a ceiling lift, and it lifts people out of the beds and goes clear into the bathroom and the shower, and keeps people safe when they're too weak to stand and walk. There's a sink area, there's a closet for personal belongings, dressers for personal belongings. We encourage people to bring photos and things like that. They can't nail anything into the wall, but they have those little sticky strips now, I think, that hold up pictures. But your own blankets, your own clothes, your own grooming supplies is always nice, and photos especially. Our bathrooms are quite large. There's a shower and a shower chair in each bathroom, and then a sink, of course, and a toilet. And there's call lights everywhere that people can pull for help if they need it. And the call lights, of course, for assistance to go into the bathrooms. And these are the beds. The air mattress here, each bed has an air mattress, so it can have fluctuating air pressure, so that we can help prevent some of the sores and stuff that happen. Over here is one of the sofas that I was talking about. These convert into a bed, but it's also a nice place for people to eat, visit, bring their laptop or iPad in. TV in every room. One of our patients bought a new, bigger TV for every room because the Olympics were going on, and she wanted everybody to be able to see the Olympics. We had smaller TVs, and she couldn't tell who was Russia and who was the United States, so she bought one for each room. So that's kind of cool. That's the kind of patient satisfaction we get here, and the love that you feel here at the hospice house. Out here is one of the patient patios. They each have a table. Sidewalk goes the whole length. You can see one of the birdhouses on the tree over there. That was just made. And then there's also a bench, and we have pads on the benches too. All sorts of garden features out here. Okay, and also next I'll take you down to our jacuzzi room. We have a really nice, it's basically a spa. There's a place to get your hair done, your nails done, everything down there. So we'll head down the hall and do that. We can look at some of the beautiful artwork. One other thing in one of the rooms is if you need oxygen or anything, it's behind what looks like a painting on the wall, but that was a great idea. So kind of keeps everything more home-like. This was something made by the community. You can see as we go all the different artwork, but we have people playing chess or checkers here quite a lot of the time, so that's really nice. And this is the jacuzzi room I was speaking of. There's, of course, it is a regular sink and a stool, but there's also the hair station. Some of the CNAs will trim hair, give haircuts, have a really good hair washing, and then back in here is our jacuzzi. And the side of it comes up. So it's easy to get in and out of, and then of course back down. But some people just love to do that every day. Next is the nurses' station. This area is where the nurses and the CNAs are. There's basically 4 rooms on one side of the nurse's station and 4 on the other side of the nurse's station, all identical. But this is where the nurses are. There's one of the nurses, Alice. There's a lounge area for the staff back behind the door and stuff. But as you can see, it's a very home-like environment. The hall is fairly long, so, but for that reason, we have a refrigerator and a refreshment place right here. So here's kind of another private area for people. And then we have the refrigerator, a Keurig coffee maker, and we keep all sorts of snacks and stuff in there for families to use at their leisure. And that's basically the tour of the hospice house. Thank you very much.
Do you have any questions?
Does anybody have any questions?
I don't. If you just want to let us know what phone number they need to call, and then I'll also post our website.
Okay. The number to call if you have any questions is 307, of course, 578-2413. Any of us are happy to talk to you anytime if you have questions about our hospice services, need clarification, or any other information about hospice. We're happy to meet with you. Thank you.